Hello, everyone. I want to talk about the most invasive and powerful neuromodulatory technique that we have, which is deep brain stimulation. And I want to discuss whether this technique could help individuals with severe ME/CFS or long COVID. In other words, people who are homebound or bedbound. First of all, before I get into that, sorry I wasn't able to do a video last week. You may know that there were several conferences and talks going on over the past 2 weeks, both on ME/CFS and long COVID. And there is so much going on internationally that we're finally at the point where it's very difficult to stay on top of all the research. And that is a good thing because it means the pace of progress is much greater than it's ever been in the past. And as a scientist who wants to cure these diseases, I love to see all the work that's going on. But it means I didn't have time to do a video. Um, so the paper that I'm mentioning today is not in ME/CFS and it's not in long COVID because, to my knowledge, deep brain stimulation has never been performed in those conditions. But I'll note in a little bit the potential relevance to those conditions. So anyway, here's the paper, which is open access, I believe. I put the link in the video description. Now, this is a case study, which means it's about a single person. And there are many other papers I could have presented on this topic with more participants, but this one is brand new. And I tend on this channel to do papers that just came out in the last couple of weeks. So I went with this one, even though it's just on one individual. So this is a case of a 54-year-old woman who had a hemorrhagic stroke, which means a blood vessel burst in her brain. And specifically, this occurred in her left thalamus. Now, when this happens, there can be severe numbness and a loss of all feeling on the opposite side of the body. But over time, things can change. The neurons will attempt to reestablish their lost connections, but because there's scar tissue, probably glia scar tissue, the neurons can make abnormal connections. And unfortunately, one of the things that happens is you can develop central post stroke pain, which is very severe and unrelenting pain on that opposite side of the body. And it can feel like burning, it can feel like knife stabs, it can feel like electrical shocks. And this is typically pain that's there 24 hours a day, every day. And there's a good chance it'll stay for the rest of the person's life. And the worst part is it's highly resistant to pain medications and treatment because the pain messages are being generated from the brain. It doesn't have anything to do with a problem in the body. So, what do you do when you're faced with a lifetime of pain that's so extreme you can't sleep, you can't work, you can't do anything else? And you've tried everything that's available, every medical treatment, every complementary alternative medicine treatment, and the pain is still there. So, when all else fails, there is one final technique. It is the most invasive treatment, but it's also the most powerful because it involves directly modulating brain activity as opposed to the things I usually talk about, which is non invasively changing brain activity. So we're talking about deep brain stimulation or DBS. Now, with DBS, small burr holes are drilled in the skull, usually at the top of the skull. And then the electrodes are fed down through the brain to the specific area to modulate. And then you have wires coming out of the skull, and they lead to pulse generators that are implanted in the chest, and they control the electrodes. Now, this is used for Parkinson's and for severe depression and chronic pain. Those are the conditions it's mostly used for, but we're exploring other uses for it as well. Now, in this particular case from this paper, the neurologists and the neurosurgeons wanted to target two regions of the brain instead of one. So they targeted the left thalamus, which was the epicenter of the stroke, of the bleeding. And then they wanted to target the periaqueductal gray, or the PAG, which is a brain region that controls pain relief in your body. Now, the idea of modulating two different brain regions is because these regions are involved in pain in two completely different ways. And so you're hitting the problem in two different ways. And this increases their chances of fully removing or eradicating the pain. So let me show you real quickly in the brain where this occurred. This is a person that's looking to the left, and the holes are drilled at the top of the skull, and then the leads are fed down through all the brain tissue. And then the first electrode stops around here at the left thalamus, but the placement is much, much more precise than what I'm talking about here. They're targeting a very specific part of the thalamus. And then if you keep going further down, the second electrode stops down here in the right paractoductal gray or PAG, and that's where the second placement is set. So they place these electrodes, they test it during the surgery. If they test if they have the right spot because the person is awake, that way they can give feedback on if they've got the right region or not. They'll turn on the electrodes and the person will know if it affects the things that it's supposed to affect. And that way the surgeons can be sure they're in the right place before they close everything up and end the surgery. Now, after that, after the surgery is done, it's just a matter of over the next few days and weeks and months, finding the right settings to get optimal effects. You can change the pulse sequences by controlling those pulse generators that are implanted in the chest, and that can be done wirelessly. So, how did it work? You can read the paper for the full story. I encourage you to do that if you're interested. But the short story is 1 year later, her pain was gone. There are a lot of outcomes they used. I tend to use the pain VAS or visual analog scale, which is a 0 to 10 severity scale. And 1 year later, her VAS is 1, which is negligible pain. And so this procedure was a great success in this case. And this has been shown to be highly successful in many cases over the past 10 plus years. Okay, so now what about if you're housebound or you're bedbound with conditions like ME/CFS? Could something like this help? First, it's never been tried before. The reason is, you probably know most of this, it's very invasive. You don't want to get this wrong because you're opening up the skull, you're putting holes, small holes, but you're still putting holes in the skull. And this is dangerous. It's risky. The technology is improving, but you still have to be very careful and make sure you don't make a mistake. There's a lot of chances of something going wrong. So you can't just put electrodes in wherever and test it. You have to know where you're going. And the problem with ME/CFS and long COVID is we don't know exactly where in the brain to target. With pain, which is what this paper was about, the pathways are very well described. We know we have a really good idea where we should target, or a pretty good idea. There's still some guesswork, but we have it pretty much nailed down. With fatigue and related symptoms, there is less clarity because it involves even more of the brain to process those things. We know the general regions that are involved in ME/CFS, but again, with deep brain stimulation, you have to be extremely precise because you only stimulate a small part of the brain. And if you're off by just a couple of millimeters, that can mean complete failure. So you have to be extremely accurate. It's also really difficult to test deep brain stimulation in ME/CFS because we don't really have a good animal model for the condition. And so you can't test different brain regions before you start doing it on humans. But despite all those caveats, we do have some good guesses. As you have probably heard me discuss before, the first target would probably be the subgenual anterior cingulate cortex. And this is a region that works extremely well in some cases of severe depression. And while ME/CFS and long COVID are not depressive or mood disorders primarily, there may be some overlap in how the systems in these conditions are involved. Another region I would like to see tested would be the hypothalamus because of its role in producing chemicals that keep us awake and alert. And there's other regions as well. So I wouldn't expect to see deep brain stimulation for ME/CFS soon. That's probably because there's less invasive approaches that I've talked about before, like focused ultrasound and transcranial magnetic stimulation. And these are going to be much more popular because we just have so much more latitude to test different regions and different parameters. But I do see a role for deep brain stimulation in the most severe cases of chronic fatigue and post-exertional malaise and just inability to get out of bed. While having leads coming out of your brain and having implanted devices in your chest, of course, that's not optimal. But that versus being stuck in bed for the rest of your life, I don't think there's any question which one is preferable. The annoyances of having these implants, I think, would be nothing compared to what's gained by getting functioning back. And even better, the technology is improving rapidly. And so you may have noticed I put a picture up at the very first of this talk and showing the leads. And one thing it showed is that there are groups that are working on deep brain stimulation devices that don't have leads coming out of the brain. There's no wires, there's no chest implants. Everything is self-contained in the brain, and the device can be recharged without having to physically pass the skull, which is a game changer. Makes it much more safe to keep this in for a long time. So anyway, for now, so no big news with this in things like MECFS, but just remember that I mentioned this. It could become important in the future. When I see important advances in this relevant to MECFS or long COVID or Gulf War illness or related disorders, I'll be sure to mention it on this channel. So that's it for today. Just want to talk about that for a few minutes. Do keep track of the videos. I have some important new initiatives to talk about very soon in the next month. So thanks for watching, and I will be back soon.